countries from Jordan, and Colonel Zuhair Tamimi, who is the head of training and qualification section in Jordan. He serves as colonel in the military career, has been a challenging combination of command and staff roles in the Jordan Armed Forces and the United Nations. He is working now at the center on preparing policies, strategies, and plans for internal and external training and joint exercises at all levels: strategic, operational, tactical. In brief, he will present how the pandemic crisis has developed in Jordan besides the governmental and social measures and decisions, continuity of government during crisis, and conclude with some summaries. Actually, this lecture is very interesting because Jordan is very close to Bulgaria situation and almost in the same disease person and the same parameters. I would like just to open a bracket. We are working very close with Colonel Tamimi, and next year actually we will conduct together 12 common events with courses, seminars, even exercises. Tamimi, I'm very satisfied to hear you and welcome on our conference. Now the floor is yours. Can you hear us?
Yeah, I can hear you, Colonel. Good morning, ladies and gentlemen, and thank you for your this nice presentation. Actually, my name is Zuhair Tamimi. I'm from the National Center for Security and Crisis Management. It is, many thanks actually for the CMDR Center of Excellence and for the NATO partners to give me this opportunity for give just a short presentation about the role of our center during this epidemic disease. Actually, I will start my presentation talking about the role of our center during COVID-19 pandemic and the continuity of government during this actually crisis. And my presentation will be under the following headlines. They are shown on the screen, I think.
Yes, everything is fine.
Actually, the center working in three levels: tactical, operational, and strategic. And from the first time when we were dealing with this pandemic, we were activated at the strategical level. And this crisis was going through our concept of operations. When we predict that it will be a crisis in Jordan, there was a close follow-up from the center and evaluation for this, and then there will be activating for the list of our directors. Directly, the board of directors were gathered, and there was a brief, and they declared it as a crisis at the national level. And the board of directors appointed the Minister of Health in Jordan as the crisis leader, and now the center operates as a command and control center. Of course, all the emergency operation centers were activated all over the country: the ministries, the private sector, the JAF, the security agencies, as well as Ministry of Foreign Affairs, through our center connected with all of these, and also providing the common operation picture to all those who are working on the center. Now we deal with this actually pandemic by responding to epidemic diseases and activated. There are 10 national contingency plans have been established by the center in cooperation with different ministries and security agencies, and one of these national contingency plans were the plan which is responding to epidemic diseases. It is fully activated. Now I will go just through and go in brief with the sequence of events, starting from declaring the first case in coronavirus in Jordan. Actually, on the 2nd of March, the Prime Ministry of Jordan reported the first case of coronavirus in Jordan for a 30 years Jordanian male who showed symptoms of the virus 16 days after returning from Italy. So now our center has been activated, like I told you, at the national level to follow the pandemic through activating the National Contingency Plan for Pandemic Prevention and appointing the Minister of Health as a crisis leader. Of course, all liaison officers from all ministries, institutions, and security agencies were attached to the center. Many of them were participated in different exercises and workshops held at the center within the DCP project and other projects as well, which had the greatest impact in dealing with this pandemic in a systematic and professional actually manner. Now on 15th of March, His Majesty actually, His Majesty King Abdullah II chaired the meeting of the National Policy Council at the National Center to discuss the implications of the corona crisis and to determine the extent of the kingdom's preparations to confront this epidemic. Then the Jordan government declared a state of emergency on 19th of March and imposed a curfew on 21st of March. Therefore, a crisis cell was formed at the center from the Jordan Armed Forces, also working in coordination with our staff at the center in managing this crisis in order to set the restrictions and the controls, the necessity for public life in order to contain the virus. Of course, from the first day, regarding the media coverage of the crisis, the media coverage for this epidemic were done from the center in regular basis, like I told you, from the first day by the Minister of State for Media Affairs and Government Spokesman, and the Minister of Health and the Director of the Crisis Cell from JAF, Jordan Armed Forces, in addition to the competent minister when he is needed in order to prevent any fertile environment for roamers. Actually, there are many efforts and many decisions taken by the government during this situation, and we can say that, first of all, halting all air travel from and to the kingdom starting from 17th of March until further notice, except for the commercial cargo, and also all land, sea border crossing were shut to the passengers movement, and only commercial cargo was allowed. The Ministry of Education also commenced the distance remote learning plan through the ministry's site and through television stations. Also, the crisis cell within the center working 24 hours, 7 days to follow up the developments related to COVID-19, and a lot of task force were established. For example, medical care task force, border control, crossing and airport task force, social protection task force, strategic reserve task force regarding food and drugs, and media follow-up task force. Talking about the digital platforms, regarding launching all those platforms, the government also, through the National Center for Security and Crisis Management, has started from the first day to plan to activate digital platforms so that the lives of the citizens are not disrupted with the continued social divergence and quarantine. As the private sector and the Ministry of Digital Economy were used in this matter. The digital platforms are numerous in the fields of such as health, education, and delivery. Also, a lot of advertisement and a lot of the brochures and videos were distributed to all social and in the media by the media response unit in the center to give clear information about this coronavirus and how to deal with it. Now, just let me talk in brief about the current situation. The cumulative number actually of tests that have been conducted throughout our country until yesterday evening, Wednesday, 13th of May, has reached 127,307. And actually, you know, at the beginning of the crisis, there was limited number of beds, but now we have approximately 1,513 beds ready to receive the cases of coronavirus. And I remember from the first day, we just have maybe 20 to 25 epidemiological investigation teams. Now we have 160 teams cover all the kingdom, and they are working 24 hours. Actually, we have now 582 confirmed cases by coronavirus in the kingdom, 92 now recovery cases, and we have 128 cases under treatment. We have 9 deaths. The first death actually was for a lady who was 70 years old. In 28th of March was the first death. Let me just summarize my presentation, since we have just a short limited time. Actually, this is a new situation, and we conducted a lot of exercises, but this is a real really situation, and hard, and we have to deal with it. Actually, it is impossible for our country, let's say Jordan, to remain empty of this epidemic in light of its spread widely in the whole region and in the world. And the zero situation that passed through the past few days did not mean the end of the epidemic, but rather broke the chain of its infection and control its spread internally temporarily. And it is not possible for the kingdom to continue closing on itself for unknown period. So coexistence and adaptation to this epidemic and its consequences is the inevitable way until the emergence of a global remedy. And adherence to the protocols of social distancing and the public safety procedures are the only solution. Therefore, I have to deal with people as I'm infected and to treat them as they are infected too. Otherwise, things remain in the circle of wishes. With this, actually, I conclude my presentation. Thank you for your kind attention, and I'll be glad to answer any questions you may have.
Thank you very much, Tamimi, Colonel Tamimi. It was very informative. Actually, I was wrong. We started with the equal situation, but I see that the situation in Jordan is much better than Bulgaria. We have almost the same question. Very shortly, could you say maybe some in addition, because in your presentation we saw that you answered already on the first three questions, but for me is interesting the question how you deal with this one.
Do you hear me?
No, wait just a moment. How you deal with this one and how you manage to keep this low level of disease and low level of deaths actually. It's a very good positive case for Jordan for us. Colonel Tamimi? Did you hear the question?
I conclude. Do you hear me? Colonel?
Yes. It's obviously the connection is here. Please stay online, and after the Bulgarian presentation, I'll try again to ask a question about the Jordan. Okay, next speaker, I will turn to the next speaker because we have only 5 minutes for the panel, is Lieutenant Colonel Svetozar Busilkov. He is an expert in doctrine and standardization